I mean, I know the women have their tummy tuck.
Anything that happens during pregnancy and childbirth that would stretch your skin out usually is removed.
I've had some cosmetic stuff done already, and I would love to have more.
I think it depends on how much stress your body goes through.
I've had 4 children and I have considered it. I am a little nervous, however, about the general anaesthetic and the dangers that go along with that.
I think it's a huge pressure nowadays, having yourself look the best you possibly can all the time.
And it really isn't a pressure to have plastic surgery, say, but they do want you to be thin. And so if diet and exercise aren't working for you, or it's just something you choose not to do, I think that's really probably the best option.
I don't think everyone necessarily feels on their own that they need that done, but if they have family or friends that are looking better than them, they feel the pressure.
I think it's for the individual to decide on what's really important to them. If that's really important, they should do it if that makes them a happier person.
It's a little easier than the exercising and the diet, and sometimes you just want those instant results that make you feel better about yourself.
Well, we're back in the studio with Dr. Clayton and Cami to talk about the results of her final part of the mummy makeover. Cami, how are you?
I'm good.
All right. You're looking pretty good.
Thank you.
Okay. Last week we saw breast augmentation and breast lift. Okay. This week we've seen the tummy tuck and liposuction. How did you feel having that done?
I'll be honest, it was rough the first couple weeks.
Really?
A lot of pain, but after that I felt great.
What was more painful? Step 1 or step 2?
Step 2, obviously.
Yeah, step
It's
2.
more invasive, I think.
Really?
Yeah.
And speaking of invasiveness, is that really true? Having liposuction and a tummy tuck is quite invasive?
Well, compared to the breast part, it's more extensive.
Yeah.
And therefore, tightening the muscle, I think, is the part that gives you the most pain.
You can't stand up straight
Really?
for the first couple weeks, yeah.
Okay.
You feel you're hunched over pretty much.
And when can you have full movement again after the operation?
We generally like our patients to straighten up by about a week to 2-3 weeks, somewhere in there. But that doesn't mean they can do a crunch in the gym at that point.
Yeah. So you were saying that regarding exercise, you were back in the gym, what, 5-6 weeks
5,
later?
6 weeks, yeah.
And is that normal, Dr. Clayton? Because she was pretty fit to begin with. Like she wasn't obesely overweight, and she wasn't doing it to remove huge amounts of skin.
True. That is pretty typical for the tummy tuck part. With the breast part, people are back in the gym maybe more like 3 to 4 weeks.
Wow, amazing. Scarring, have you got much?
Oh, yeah.
Okay, and what are you doing to help that recover?
Well, I still have my steri strips on
Okay.
for another month, I think, and
Okay.
then, yeah, just keeping them covered. It's supposed to reduce the scarring. And
Okay, how does that reduce the scarring, Dr. Clayton?
Well, the tape gives mechanical support to the scar. The tension on the scar line wants to pull it apart and widen the scar. And the tape helps prevent it from doing that, as well as the deep dissolving sutures we put in. The other thing it does, it puts a little pressure on the scar to prevent it from raising up.
People often ask me, Dr. Clayton, when they're on the shows, about scarring. And is there anything that they can do to prevent the length of the scarring before the surgery? Is there anything they can take? Are there any potions and lotions? What's the deal? Or scarring is scarring?
Unfortunately, scarring is scarring. There's nothing you can do ahead of time. There are different lengths of the scar we do for a tummy tuck, depending on the needs, though.
Right.
And there's such a thing as a mini tuck, a mini abdominoplasty where the scar is shorter. But in general, we don't tighten the muscles as much in that procedure.
Okay, you were saying that breast lifts can later on droop again and you might need a tightening up. Is that the same with the tummy tuck?
Less so, actually.
Oh, okay.
It's possible, and I'm often asked, well, when should this be done? Should I be done with my family? And generally that's the advice we would give, is you do this after you're finished with your family. But you can actually go through a pregnancy just fine having had a tummy tuck.
Cami, question to you.
yes.
What do your friends think? Because you actually told me when I first interviewed you that you weren't going to be telling them.
Right. I've only told a few people, and I didn't want it to be so dramatic and drastic that they, someone could say, well, you've had work done. I wanted it to feel normal.
Okay.
And so, but the ones I did tell, they've been very complimentary and supportive, so.
Okay, do you feel there's pressure on you as a woman to always look your best and go the step above? There's a lot of pressure on women in society, isn't there?
Yeah, especially if you've had kids. You see the celebrities that bounce back into their pre-baby bodies, and
Well, hold on. Well, they've got chefs.
That's
They've got
true.
trainers. They've got
That's
the whole thing. They've got Dr. Clayton on speed dial. What did your husband say when he finally saw everything that was put together? He went, "Oh, there's the wife I married."
yes,
But he didn't think you needed it
No.
to begin with, did he?
no, he's been very supportive either way, so.
And do the kids, your boys, you got 4 boys?
They don't really notice. They're just in their own world. They don't pay attention. They're like, Mommy went to the hospital for a couple days, and she was in bed a lot,
Yeah.
but they don't really care. They don't.
Okay.
They don't really notice.
I asked you when we first met regarding being ready mentally, being ready physically.
Right.
How are you dealing with that now? You've said you've had a little bit of pain.
Mm-hmm.
It was much harder having the tummy tuck and the liposuction.
Yes.
You had the breast augmentation and the breast lift, and I believe it was like 6 to 7 hours. Is that
That's
right?
right.
And is that the normal length of time, Dr. Clayton, that you would be under anesthesia?
Somewhere between 5 to 7 hours would be
Okay.
pretty typical for that much surgery.
I wanted to ask you one question, and then we can wrap it up. What part, when a woman comes into you, or a man, do you ask them about their mental stability, about the reasons why they want to have this done? Does that go through your mind? Do you ask those questions?
Yes, it is. It's a very important concept and question to have answered. And so it's in the first visit that
Really?
as I'm assessing their motivation, why do they want this done? What are their goals? Are their goals realistic? Or are they unrealistic? Do I have a good feel about this patient being a good candidate for the procedure?
So when he was asking you those types of questions, were you feeling insecure? What was your thoughts when
Oh,
he was
yeah.
asking you that?
I've had 4 babies, and so I felt very insecure. And it's only benefited me, my self-esteem and my confidence.
Yeah.
So,
You said to me
yes.
from day one that your main goal for this is to get back into that bikini.
That's right. I've never worn a bikini. I've always had to hide it, in one piece. So this summer I'm going to flaunt it.
I love it. I
I'm
think
gonna be
it's
proud,
fantastic.
so.
Good for you. I've always been a believer, Cami, that if you want to have cosmetic surgery, if you want to have anything done to your body, that's your choice. You make
That's
those
right.
decisions in life. You live by them, and they're your choices. Are you happy with your choice?
I sure am.
You know what? So
No regrets.
exactly, and I love that. Guys, thank you so much for sharing this incredible journey. I think it's been a great success. If you want to find out more information about Cami's Mummy Makeover, head over to my webpage at theyoungeryou.tv, and I'll see you next week.
Coming up next week, we'll be learning all about varicose veins. We'll be hearing from Dr. Nesbitt about what varicose veins are, as well as how to treat them. We get to meet Kurt and see the procedure he went through to have them removed.